guys, welcome to my channel. My name is Savannah and I am here to discuss how you can get 100% on your HESI A2 Anatomy and Physiology section. Here are my credentials, and this will show that I actually did get 100% on this section of the HESI A2. So I do want to talk about my background. I am a pre-nursing student, actually just got into nursing school, and I have taken anatomy and physiology, so that's been extremely helpful. If you haven't taken anatomy and physiology, I highly recommend that you do. If you are applying to a school where they allow you to take anatomy and physiology within the nursing program, awesome. These tips will still be beneficial for you, but I think it's extremely important and very, very helpful if you've already taken anatomy and physiology. So this test is gonna revolve around the basic knowledge of anatomy. They're gonna ask you questions regarding anatomical planes, directional terms. So like medial versus lateral, distal versus proximal. Okay, so another thing that they are going to question you guys on are the layers of skin. So I'm going to go ahead and list those 3 layers right here. Specifically when it comes to the epidermis, they're going to ask you questions in regards to the most superficial layer all the way to the most deep layer, and also vice versa, because I think there is a question on there that asks you what are the layers of the epidermis from the most deep to superficial. So pay close attention to the question, because when I first was doing like a practice question, I read it and I was like, oh, superficial to deep, click, and then I got the question wrong. So make sure that you guys really pay attention to the questions. So in the integumentary system, you also are going to know what is in each layer of the skin. So for example, know that in the epidermis, at the very top layer is keratin. When it comes to the dermis, know that the dermis contains blood vessels. So those are things that you're gonna wanna know the difference between. Another thing that they're going to ask you guys about is eccrine versus apocrine glands. So make sure that you know the difference between that. Now, in regards to the skeletal system, you basically just kind of need to know the most basic like bone names. They're not gonna like pop up a photo and be like, name this bone. It's not gonna be like that. But they are going to ask more scenario type questions. So for example, they may ask you a question in regards to like the sternum and be like, so-and-so is experiencing pain in their sternum. What bone is that patient having pain with? And then it'll give you a list of different bones, and then you'll just click the one that you think is a part of the sternum. Another thing that you guys are going to need to know in regards to bones is the different bone types, such as like flat bones, sesamoid bones, long versus short bones. Just kind of know which ones are long, short, which ones are considered flat bones, etc. Know the difference between a tendon and a ligament. So for the life of me, I couldn't remember the difference between a tendon and a ligament until I came up with this mnemonic. I hope it helps you. For a tendon, I tend to like men with muscles. So that's how you know that a tendon connects muscle to bone. And then you'll just know that a ligament connects bone to bone, but I tend to like men with muscles. Joints. So when it comes to joints, they're going to ask you the different joint types. There's maybe like 1 or 2 questions. There's not that many. They're going to ask you, oh, what kind of joint is this that creates this movement? So know like the difference between a ball and socket joint, a hinge joint, etc. In regards to muscles, they're going to ask you the different muscular tissue types. So know the difference between smooth muscle, skeletal muscle, cardiac muscle, so on and so forth. They are going to ask you a lot of questions in regards to that. For example, they'll be like, what type of muscle creates voluntary movement, or what muscle creates involuntary movement? So just know the differences between each one and where they are located. So know where they are located, whether they are located in your intestine, in your heart, things like that. Okay, circulatory system. So in regards to the circulatory system, they are going to ask you questions regarding blood flow. So now how the blood flows through the heart back into the tissues. Something that you definitely are going to need to know are the 4 chambers of the heart, your 2 atriums and 2 ventricles. Make sure that you know the difference between arteries and veins. Know that arteries carry blood away from the heart and that veins carry blood to the heart. Another thing is knowing which blood vessels carry deoxygenated blood versus oxygenated blood. So know that veins carry deoxygenated blood, but when it comes to blood flow in the heart, know that the pulmonary artery is the only artery in the heart that allows deoxygenated blood to go through to the lungs, become oxygenated, and then the pulmonary vein is the only vein that carries oxygenated blood back into the left atrium. So there are other topics in the anatomy and physiology section that I'm not going to talk about, but I will give you some great resources that helped me get 100%. Okay, so the very first one, I know everybody has seen this book, the HESI A2 Secrets. I really feel like this book, it can be beneficial if you are doing this. Plus, you're using like the Elsevier book. I think that's how you say it. Elsevier. You got what I'm saying. If you're using this hand in hand with other things, I think that it can be helpful. Honestly, you know how everybody gives their degrees to Quizlet? Well, I am giving my 100% to Nurse Hub. So this book, again, it can be helpful, but honestly, I barely opened it. I opened it for other subjects that aren't anatomy and physiology related, and I thought that the tips in there were very helpful. So maybe if you want to use this for other subjects, that would be great. It gives you kind of like a brief overview, but it doesn't really go into depth. And that's kind of what you want to know, is like in-depth information. So Nurse Hub on their website mentions pass your nursing school entrance exam the first time guaranteed. And literally, they're not lying. They are not lying at all. This is literally the only thing that you need for anatomy and physiology. They are helpful for the other subjects as well, but honestly, I got my 100% because of Nurse Hub. So on Nurse Hub, they go over all the different topics regarding anatomy and physiology, and they create these videos, and at the end of those videos, you will do a time test. So something that I did was, whether I was on my commute to work, I was in the shower, I would be listening to these videos. And then after each video, I would take the quiz, and then it will tell me like what questions I got wrong, what questions I got right. Your biggest reason for getting 100% are these last 5 time quizzes. This is the biggest secret of all. Those 5 time quizzes are literally the entire HESI A2 anatomy and physio portion. All the questions that are on Nurse Hub aren't word for word, but they're worded a little bit differently. With that being said, I do not recommend just going on there and being like, oh, let me just go ahead and do those last 5 time quizzes. I'm going to be fine. No, I think it's extremely important that you still have knowledge and understanding of anatomy and physiology before you do these. However, when you do take the 5 time quizzes, you are able to take them over and over and over and over and over again. So it'll explain to you when you do get a question wrong. It'll tell you why that answer is incorrect, and it'll also tell you why the answer is correct. So that will definitely help you with just understanding the material better. If you're able to, I highly suggest that you take about a month or 2 months to really study for anatomy and physiology, and also the other subjects as well, before you take this exam. If you are like me and you're like, "Ooh, girl, it's been a long time since I've taken anatomy." So I took anatomy and physiology in like 2016, 2017. So it's been a couple years, and I honestly definitely needed a refresher. Nurse Hub helped me just give a quick refresher of anatomy and physiology. I also have a lot of my anatomy and physiology notes from when I was in school, and so I would follow along with my notes, Nurse Hub, or any other resources that I did use. Okay guys, I really hope that you guys found this video helpful. If you guys have any questions, please comment them below. Don't forget to like, subscribe, and ring the bell for future videos. Bye!